Hi, my name is Ralph Donsky,
And my name is Barbara Donsky.
and we live in Tucson, Arizona. And for the past 3 years, we've been clowning for adults who are ill in hospitals. And the beginning of this year, 2008, we started a formal clown program at a hospital here in Tucson, Arizona. And what this video is about is that it's a training video intended to show you as new volunteers how to perform this skit for adults that you visit in a hospital environment as well. And since there are no patients here, Barbara and I will use each other as patients to demonstrate this skit that we perform. And I'm going to let Barbara start.
Hello. As again, my name is Barbara. And what we're going to do is we go in and we walk into the room and we ask the patient if we can cheer them up for a few minutes. Most of the time we are invited into the room. Then we introduce ourselves by our names. And in my case, my name is Dr. Too Short, which is embroidered on my doctor coat. And Ralph, and I introduce Ralph, and I say, and my partner is Dr. Make You Better. I tell them that we're here to cheer patients up, and I'm sorry.
And then what we tell them is that the hospital, the doctors in the hospital are really excellent, but a second opinion never hurts. So what we tell them we would like to do is a few simple tests to see if we might be able to come up with a prescription that their doctors didn't think of to help them get better in the short term. And so we then proceed to do our simple exam. And I'm going to start, and the first thing we tell them is that we're sure the nurses take their temperature regularly, and we find that sometimes the temperature can really give you clues as to what the problem is. And so I'm just going to get my thermometer, and if you don't mind, could you please open wide? Oh, that'd be a little tough to get in here. Well, your temperature was right where it's supposed to be. Very good.
Right. And then I go ahead and I ask them to open wide because, like any medical professional, you want to look at a person's throat. Oh, look, you had a frog in your throat.
Oh,
Maybe now that it's out, you'll feel better.
I thought I felt a little bit hoarse. Oh, okay, thank you. Alrighty. And then I proceed to do another simple exam. I tell them that I know doctors are always listening to their heart to make sure everything is okay. And however, I want to do my own independent exam. I have a very good stethoscope, and this stethoscope is very sensitive. And it's going to really make sure that your thumper's doing okay. So let me get that stethoscope. Alright. And how about if we plunge right into this exam? Oh, every beat sounds great. You're in good shape.
Thank you. Dr. Make You Better, I think in order to come up with a good diagnosis, we need to do a CAT scan on this patient.
Oh, but CAT scans are very scary and
well, that's
difficult.
if a regular doctor performs it, but we're laugh doctors.
Oh, okay.
So what I'm going to do is do a kitty cat scan.
Oh, okay. Did that cat have any fleas?
No fleas.
But we want to bring fleas in the hospital. There's enough problems in here.
Yes.
Okay, very good. And now we're done with the exam. And as we said, we wanted to come up with a prescription for renewed health. And we have that prescription.
So what we do is we bring a pad of prescriptions, and I turn one off, and I give it to the patient, and I said, I will read it to you. And so it says that starting immediately, apply sunshine to your life every day.
But remember, the sun is strong, and you have to protect against those rays. So use sunscreen and a hat.
And you should smile and laugh at least once every hour, and apply 11 large doses to the people around you all of the time. And never forget that laughter is the best medicine.
Oh, that's a great prescription. And then we do one other thing, and we'll be giving each of you volunteers a little packet of special coupons. And so we tell the patient that when we go shopping in the market, we're always clipping coupons to save pennies. And we have a coupon for something very valuable they won't find anywhere else, that they could redeem at any point in time. And it says, coupon, redeem for 1 free smile. And it also says, no expiration date. So you can give these out to every patient and their visitors and tell them the best thing about this coupon is you could use it whenever you want because it never expires. So that's our little skit. And then I'll add that you could also add some things to this skit, such as magic or balloon animal twisting. And as a matter of fact, we do both of those when we go into the hospital, and most adults and children as well, but everybody loves magic. So you could feel free to integrate a little bit of magic into this skit, and if you do balloon animal twisting, the patients love that as well. And of course you want to check to make sure no one has a latex allergy, but assuming they don't, they'll get a lot of cheer out of it.
And I do want to point out, even though Ralph and I do the skit together, to spend time together on weekends, the skit can be performed by one individual to the patient. There is no restriction that you have to go with a partner.
Okay, well thank you Dr. Too Short. Well thank you everyone for your time in watching this short training video. And we're very excited that you're becoming new laugh doctors in the Clown Care program. And we're sure that you're going to find this to be extremely rewarding, just as the two of us had. And there's really nothing more important than spreading cheer to adults who are ill in the hospitals. Thank you.
Bye, thank you.